I have not had any doctors talking to each other. Even scleroderma specialists, getting them to talk to one another is really challenging. So, when you have scleroderma, I see a pulmonologist, I see a cardiologist, a gastroenterologist, I see the rheumatologist, I have 2 scleroderma specialists. You start adding, I do see a GYN, probably very little, her understanding of scleroderma is probably almost non-existent.
On April 12, 2023, the Stephan Scleroderma Research Foundation and its partners, the Scleroderma Clinic at Albany Medical College, the Albany College of Pharmacy and Health Sciences, and Russell Sage College hosted the 6th Interprofessional Education event for scleroderma. 3 of these events have been live and 3 virtual. What makes the Scleroderma IPE so unique and so valuable is that our participants include scleroderma patients. The patients directly interact with healthcare students in a growing list of disciplines including dentistry, medicine, nursing, nutrition, occupational therapy, pharmacology, physical therapy, psychology, and social work. The students are further guided by a panel of experts who are practitioners and educators in each of the participating disciplines. Dr. Lee Shapiro is the Chief Medical Officer of the Stephan Scleroderma Research Foundation.
One of the foundation's missions is to increase awareness of scleroderma among all health professionals. Our goal is to accelerate diagnosis, improve the level of care, and promote collaboration among all the health professionals who may be involved in the care of an individual with scleroderma.
The core of the program starts with a keynote address by a patient advocate. Amy Geetson has been our patient advocate for all 6 IPEs. She discusses scleroderma's effect on her day-to-day life and, most relevant to the IPE, what she needs from her healthcare providers.
We need you. We need you to survive. We need all of you to be on the same page when it comes to our health. So please take this responsibility seriously, because my life and the lives of other patients, maybe sitting right next to you tonight, greatly depend on all of you sitting here and your commitment to fighting this disease with us and for us. Thank you.
Heather Friends is Executive Director of the Patient Safety and Clinical Competency Center at Albany Medical College. She is coincidentally a scleroderma patient and has some unique insights into what are effective interviewing techniques a healthcare practitioner might use with a scleroderma patient.
Many of the patients here are going to have 6 or 7 doctors, and tonight is your opportunity to establish a collaborative relationship. I want you to not only learn about your patients that you're going to see in the room, but I want you to have an opportunity to learn about, from, and with one another.
Heather's talk led to a simulated interview with Amy. After the simulation, it was time for the first of 2 patient-student breakout sessions.
Did the scleroderma, in your opinion, have an adverse effect on your pregnancy? Did it make it more difficult, more challenging?
As far as scleroderma is concerned with the pregnancy, it was not any trouble. They obviously make you see 120 different specialists because they have no idea what's wrong or what could go wrong. The only other thing that they suspect is I actually went into labor early.
The expert panel discussion is twofold. First, the panelists introduce themselves and provide insights into scleroderma care from the perspective of their disciplines.
Dr. Allen, we will start with you.
It's a very, very broad disease, and the word that comes to mind when I think of treating people with scleroderma is uncertainty. There's a tremendous amount of uncertainty at the time of diagnosis, and really anytime you see them, people understandably, patients have a lot of questions that are very, very hard to answer because the data is not great, because it's a pretty uncommon disease and the studies are not as robust as we maybe would like. People want to know, how am I going to progress, or what am I going to need to be on, or what is this going to be like for me? And those are very, very difficult questions to answer. So
during the breakout session, the student teams were tasked with composing a question for the panel, which is now answered.
The next question is for Dr. Hotalan in the discipline of PT. Independence is empowering for patients. So from a physical therapy standpoint, how can we encourage patients to have independence?
Yeah, I think every patient whatever their diagnosis is, strives for independence. And it becomes a challenge with scleroderma because, you won't see any two patients alike.
The last official part of the agenda was a second breakout session that again paired students with a second patient.
But what would you say to yourself, like, if you could talk to the you that just got diagnosed?
You're more resilient than you think you are. Thanks for asking.
Thank you for sharing that. I'm sorry, that's making me sad.
To measure the impact of the IPE on the students, we've conducted both post-event interviews and surveys.
For me, I would say the most important aspect was to get that interaction with the patients, and more than one patient at that. You can read about this sort of thing in a book, you can get a lecture on it in class, but to actually hear firsthand experiences, to see the differences, to see the similarities, that to me is what really brings what I should learn for the future and maybe identifying this in my own practice.
Survey data collected from students in 2023 indicated that 95% of students felt a collaborative team approach to a multifaceted disease like scleroderma was important or very important. 95% of the patient educator was their favorite aspect of the IPE program. One of the major goals of the Stephens Foundation is to replicate IPEs for scleroderma in other parts of the United States.
We could set up this whole thing here in the Boston area also, because we have a very large population of patients with scleroderma, even within a few miles of the office. There's a huge cohort in South Boston, hundreds of people. There's the Scleroderma Foundation. Their headquarters is a little over a half hour from here. We've participated at Tufts in a lot of interprofessional programs, and they're always fun and they're always interesting. But this one had more different professions represented than others that we've participated in, and it was to me, having the patients involved made it so much more interesting.